Today, to this morning here and this evening where she is, we're speaking with Dr. Shan Shan Jing, who is a plastic surgery consultant who specializes in complex reconstruction. She's coming to us from the United Kingdom. In 2022, Shan Shan's life changed in an instant when she was involved in a devastating car accident while working as a fellow in New Zealand. It was an event that left her with multiple injuries, including a traumatic brain injury. And it marked the beginning of what she describes as a deeply personal and professional reckoning. Welcome, Shan Shan. It's amazing to have you here.
Thank you, Sam, and I'm so grateful to be invited into this space.
It's our privilege, and really looking forward to the conversation we had. In our call to prepare for this, as you will recall, Shan Shan said something that really struck me. She said that God's given me another chance to be the best person I can be. And that really sat with me. And I guess what we're going to talk about today is we're going to go through her journey from near death to being the best person she can be. And I think that's relevant to any doctor listening. We're going to learn about the many pitfalls of the healthcare system and navigating it, how you might as a patient, but also how you as a doctor can navigate things better to better serve both your colleagues and your patients. We're going to talk about the accident. We're going to talk about the recovery. We're going to talk about faith and its role in Shan Shan's recovery. And we're going to talk about what it means for Shan Shan, for any of us, I guess, to truly serve, because she certainly had a shift in her perspective, as you would expect from a major accident. So looking forward to having this discussion, Shan Shan.
Thank you so much, Sam.
Okay, so let's start with the accident. So can you give us an overview? Tell us what happened that led to this change in your life path, essentially.
Thank you. So I'll take you back to March the 18th, 22. So I was working in New Zealand, as Sam mentioned, as a plastic surgery fellow, doing head and neck reconstruction. And as part of my routine job, I have to make a long trip to Palmerston North from Wellington. And for anyone who's done this journey, it can be quite treacherous, and especially for a foreign driver like myself. So my partner came to support me on this journey. And in a split second on our way home, everything changed because we were involved in an awful car accident where my late partner died instantly and I was trapped and I lost consciousness and had to be airlifted back to Wellington, which I do not recall at all. And that led to the very beginning of a very long, prolonged journey and reckoning really to regain control of my life.
A devastating accident with huge consequences. So you're airlifted back to Wellington. Now you've got to navigate the health system in that recovery, don't you? So to tell us about that, I guess, both as a patient, as a doctor, as a patient, from that perspective.
Well, it was a lot more challenging than I thought. So it started from my time in the hospital. I never knew as a patient it could happen, but it happened to me that because the layers of teams involved in my care and there being an inconsistent sort of communication between different specialism and there had been a lack of senior sort of trauma coordinated care, many aspects of my care, and particularly when it comes to trauma psychology, were unfortunately missed. And of course, I lacked family support. Being a foreigner in a foreign country, all of a sudden being a very vulnerable person, I felt very isolated. And unfortunately, that was impacted by, of course, the COVID-19 travel restrictions that were happening at the time. So from very first day, I knew that I had to really advocate for myself and not to just gain health access, but to really remind people that I was still a whole person and to treat me not just like a diagnosis. So that sort of happened within the hospital remit and unfortunately continued into my aftercare in the community.
So I guess you being a doctor and having done trauma, you were uniquely positioned to have more insight into, whether things were going well or not. But not every patient's going to have that insight. In fact, 99.99% of patients aren't. So in that acute setting, and you talked about that, coordinated care, no matter what level a doctor's at, they're part of a team caring for a patient. What could they have done differently? What could they have done better?
I would say the first thing for me was empathic care. and the real understanding and active listening to the patient. Because I remember all of a sudden, I had my title, almost identity, removed as the senior plastic surgery fellow who knew my stuff, and people would listen to me and take my specialist advice, to then me suddenly lying role reversed on a hospital bed where I was labeled the patient. And so when I actually pointed out to two doctors who looked after me that I had concerns about different aspects of my injuries that weren't picked up, I wasn't listened to. I think that was hugely disconcerting to me at the time, that I realized that I actually all of a sudden, a role reversal, a labeling of a patient could mean that myself, a sense of self, had been lost through that process. So I would say the first thing I would say is really encourage all healthcare workers, and that particularly being junior doctors, to build that relationship with your patient, to truly understand their concerns and where that is coming from.
And to listen. I guess, being involved in trauma, you were in a unique position, but I remember reading a study about pediatrics and essentially the positive predictive value of a mother who said, I really think the kid's sick. And it goes back to, they may not be a doctor, but they know their child's got something actually wrong with them. Now, that's not always going to be the case, but it goes back to actually, as you say, empathic care, listening, and trying to discover the pleasure in what they're saying to help them as a doctor.
Absolutely. Yes. I think the first step is really just respect, listening, and understanding. And compassion should be taken lightly, which I think so often we're indoctrinated to learn about compassionate care. But how many of us do actually act it out on a day-to-day
Mm,
basis?
mm.
That is the hard part.
And we know compassion drops when doctors are burnt out and tired and things, which doesn't mean we shouldn't do it. It means we should be even more cognizant of, if we have to dig deep for that compassion. We do a lot of episodes around burnout and things, but actually, regardless of what state you're in as a doctor, compassion is something we've just got to find it somewhere, don't we?
Absolutely. Yeah.
So what about once you actually got out of the hospital? There's some really great lessons there, but you got out and you're now navigating into a more longer term chronic situation. What did you learn there? Like, did everything get better once you left the hospital?
Unfortunately not. So I was lost in a system that sort of transitioned from the hospital to the community. So I did have ACC involved, but of course, being on the other side of the coin, again, navigating through the bureaucracy of ACC and YNZ was completely foreign to me. And it added to the stress of trauma management and recovery than being really, truly helpful. So often I felt like I was treated more like a diagnosis or health code or a package of care that they've given me, rather than as an individual who actually needed very bespoke care. So it felt more like managing an insurance company than actually working with a health partnership to sort of manage my immediate needs. And one
Mm,
of the other challenges, unfortunately, I faced, I think was quite unique at the time, was of course, no one could have predicted COVID-19, and my accident sort of happened right in the midst of it. As a result, and as a foreigner with a work visa, I wasn't able to register with new GPs. And that meant, again, I had to be my own health advocate and really navigating the aftercare process, getting myself appropriate follow-ups and adequate specialist reviews, whereby I really didn't realize that some of the treatments and investigations were missing. For example, for my brain injury, I had to reach out to friends and colleagues back in the UK to really help me to guide through that process. That had been a hugely emotionally challenging and physically challenging process that I certainly wasn't expecting. And I thought after such a devastating accident that the key part of what I really needed to do was to relax. But unfortunately, I couldn't do that.
the thing that, when I hear that, and yes, concerns me. I've had a traumatic brain injury. I was in a coma for a couple of days, and I know that after that, you're tired. Everything's difficult. You're foggy. You're not the best person to be trying to drive your coordinated care through the community system. And the other part of that as well is that, and most people aren't doctors. Most people don't have the resources that were available to you in terms of friends you could talk. Noah's neurosurgeon, you can talk to them and go, well, actually, you should have had a scan or whatever. And so what your experience wasn't great, but you were able to kind of brute force it to a point where you got sort of what you needed, but most people won't. And so I think of us as doctors, and particularly the junior doctors who are discharging these patients. They're not driving the discharge, but they're doing the discharge summaries and coordinating what comes next. The lesson for me is this: we could do better. There's a really important role there. And so what would you say to these doctors who are discharging people back into the community? What's important? What could they do better? How could they set you up better?
Absolutely. I've been there as a junior doctor. You're always firefighting with tasks in the hospital, and the last thing you want to do, because the hospital managers or the ward staff is calling you for a discharge letter, is to do that, what appears to be a very mundane bureaucratic process. But actually, on the other side of the coin, again, I realized that what was said or not said in a discharge letter essentially penalized me into the kind of care that I was able to receive. So I've certainly learned in retrospect that a good discharge plan is an absolute safety net, and it will set me up for my crucial time and recovery for the ensuing months when I'm discharged out of the hospital. So please, to all the junior doctors out there, think of somebody like me or a close one who relying on absolutely everything that you document and clearly and concisely, and to ensure that no aspect of the care is neglected. That's really important.
When we were preparing for this, you said this to me, and I was like, oh my goodness. As a junior doctor, I remember those days when you'd like 8 discharge letters to do. And so you go and bang them out, each one in a couple of minutes. And I think that pausing now to actually, this could be the most important thing the patient gets from us. The other thing I think as well, and this is a thing, as a junior doctor, a lot of what you do is administrative, it's supportive, there's a lot of things that an administrator could do. But this could be the one thing that you can do that makes the difference. It's the difference that makes the difference. Or even a medical student. I've spoken with medical students, and I think one of the things about medical students is find ways to be useful. You're not useful most of the time. Most of the time, you're kind of in the way. Just joke. You're there to be taught, and you're asking questions and stuff, but you're not actually really helping. But this might be the one thing you go, actually, I could go and put half an hour into this and set this patient up for success. So I think this is an area for that junior staff to have a compounding effect on the care of a patient.
Absolutely. I think there's a great power in that. There's a role for every person in a bigger ecosystem that is the health system. So that you doing that particular task is so pivotal in that process that so many people dismiss because we don't see the end effects of what is to happen. So it's probably one of the most critical things that you can possibly do, that you as the end other for a patient is able to communicate effectively with the tertiary team sort of or the community team out there, and that can make a massive difference to someone's recovery.
It just occurred to me that the weighting of who's most important actually changes. And at the start, the trauma, it's the consultant, it's the registrars who are doing their job. But as the care goes on, their job becomes less important. And actually, the junior staff's job, by the time you get to the discharge, they're the most important person to set the next up for success. So thinking about where you've really got to step up and shine, I think is a useful sort of framework to take into account.
Absolutely. And it's exactly what, ACC and Well1Z will provide the service on. So if you do not write a diagnosis and it's missed, patients will not have the rights to their healthcare. And that, for me, for critical things like brain injury and several other aspects, had been the shortfalls on my discharge letter that I had to sort out as a brain injured patient in my time of critical need, where effectively, timing, as we know, Sam, it defines our outcome. So the longer that we actually get in the diagnosis and the treatment, the worse the potential outcome long term. So
Absolutely.
it is absolutely critical.
Absolutely. Some really useful lessons there. What were the other lessons that you learned through your navigation, I guess, as a doctor going through the health system?
Yeah, so as I touched on before, I felt very much like a packaged a set of service upon discharge based on what ACC was able to provide me. But it is so important to understand that we are human beings and we don't come with health codes. And there are various different aspects of our care that require proper coordination and bespoke to the individual at hand. So for me, absolutely is not just a transition from the hospital into the community with the GP and with the ACC, but certainly within the hospital being led by a trauma clinician that looks into all aspects of my healthcare because after a major trauma, it is not just a physical injury, it's your emotional injury, it's your spiritual health that all require support. And so much of my trauma psychology on top of that were unfortunately missed. And for somebody who've nearly escaped death effectively and have lost a partner, that was something, it was a huge void in my recovery process that I'm still to this day receiving help and support for. And then the other thing I would say is importantly the referral process, as I say, so be so critical in what sort of information you write to try not to miss information, particularly for the junior doctors, so that we are entitled to get the adequate referrals through ACC, and that is so important. And finally, is about just asking for help. I think so often we're so self-reliant as, you know, as a doctor, but actually realizing that you do need someone else and you do require a whole team around you after especially major trauma. So, you know, I actually reached out when I really felt burnt out. I reached out to the community and trying to seek a advocacy who was able to relay some of that information for me. So you never realize how vulnerable you become until you sort of felt like dropped in the ocean. So all those things have been absolutely critical in my case, which I feel in hindsight, and hopefully I wouldn't have to do this again, I would have had better support and help with.
You spoke about your spiritual recovery, and when we were talking, it was interesting. Faith has played a role in your recovery. So, can you share with us, that journey of faith, but also how important it's been in terms of recovering from, this huge incident?
Absolutely. Well, before the accident, faith has never featured strongly in my life. At most, I went to church maybe once a year around Christmas to the midnight mass. But beyond that, I was primarily a rational, a scientific minded surgeon. I was not even spiritual. But after the accident and having had a few encounters that sort of all I can say was that throughout the whole process, lying alone in hospital, I felt a constant presence with me. I felt an inner peace that actually, throughout the whole recovery journey, I never felt. And it's something I can't truly, really describe, but it's something that really, in retrospect, sort of glued me together at a time that I was so at lost. And so it was a sudden realization as I was in hospital that I was supposed to survive for a reason. And it's something that perhaps other people through near death experience have also experienced. There's just that renewed sense of self and reason and purpose through which you get a sense of reckoning. And faith certainly carried me through that whole process.
And in the acute phase, and has it grown? Does it continue to guide you?
Absolutely. So, like any good relationship, faith grows with time and is something that I invest time to on a daily basis. So, the first priority for me is my what I call holy trinity of health, and that being my physical health, which I still maintain, my spiritual health, being able to use prayer as my ground and practice now, and in my emotional and mental health. So, all those things I work through during the day, which really sets me up for the rest of the day ahead. And since my accident, I've sort of set goals in where I want to achieve in life, and it's something I live by every day.
I can relate to that because a lot of doctors can. We are academics. We are in the scientific community, and my life changed dramatically when I became a Christian. I guess if you had to compare and contrast life before with the purely scientific, it's all logic, and then you don't drop the science, but you add in faith. How would you compare those two? What's it? How would you describe as it's done for you as a person?
That's a great question, and it requires a lot of self-reflection. I think before the accident, when, as you say, as surgeons, or doctors, we're very factually driven. That gave me a sense of control and sometimes anxiety, believing that everything is completely within my control. And what the accident has really taught me is that, unfortunately, life will chuck ton of bricks at you sometimes, and it's completely out of your control. And having faith and having some sort of a guidance, and knowing that there is a reason for why things happen in life has really helped me to embrace the healing process and give up a sense of immediate control and or reasoning or rationalization that I knew that was never going to help me, and to really help me to pave a way to really believe that there is a reasoning for me to still be here and to live out the work that I hope to do in the future. That has given me a real sense of peace and calm that I never experienced before.
I can
And
certainly
it certainly
relate.
made me, uh, sorry, and it certainly made me a very, very much more wholesome person.
I can sense that peace in you. I said I can relate to that. It doesn't excuse you from doing the work, but it takes all the load off your shoulders, doesn't it?
Absolutely.
Yeah. So your perspective, thank you. Your perspective on service has changed, hasn't it? How did the accident and your subsequent experience through your recovery change that definition of service and what it means for you?
Before the accident, I thought service very much through my job as a surgeon, providing surgical excellence, of course. And I believe that performing my operations well is essentially what I needed to do. But I realized that actually, as I said, lying in the hospital, not knowing whether I was able to return to that sense of identity, I lost a sense of self completely. And I realized that actually life isn't about identity by your job. Life is about renewing a relationship with yourself, understanding why you're here, to what you are here to do for the rest of your life. So for me, that was a process whereby I really had to dive deep, and I realized that I have to abandon the idea that actually maybe one day I can't be a surgeon. Who am I then? And that is going to happen. We're all going to fail face retirement, and we're going to have depersonalization as a result of that process. So who are we without a job? Who are we without a title? So service for me now is understanding the roles that I bring into my day-to-day living, whether
Mm,
it's a colleague at work, or a being a surgeon to my patient, or a friend to my friends, a loved one to my family. They're all different roles that we play, and services that we can do in each of those roles. For me, it's about bringing value to all my relationships.
mm.
That for me now is service, is being present, is to listen, is hold space for the people that matter in my life and live it out with humility. Yeah.
It's a wonderful perspective. I remember years ago I learned a concept of end goals and means goals, and if I relate that to, the end is what you're ultimately trying to achieve. The means is just how you get there. And, there's a real danger in attaching our identity to the means, i.e. I'm a surgeon or I'm an anesthetist or whatever. But if we attach our identity to the end, which is I'm here to serve, then the means can be flexible. Yes, maybe I do it most of the time as a surgeon, but as you say, you're not a dad. I'm a dad. Up to me. I'm a dad. I'm a mum. I'm a brother. I'm a sister. I'm a friend. I'm part of a community where I can help as well. Like I'm not defined or limited by the means that I have picked as a career. And I think that's a lovely way to think about it. Just a shift to go, I can serve in many ways. And yes, maybe my profession is the big one right now, but I'm not completely attached to it.
Absolutely. And for that reason, I think it's so important that you touched on community, and I do serve through community. So I think I encourage everybody to learn to embrace the different roles and really seeing what the communities need. So I do soup kitchens. I try to do that once a month through church, or whether it's sometimes doing community service. So cutting our weeds in our local nature reserve so that other people get to enjoy it better. And through that
Mm.
you build new relationships and new learning that actually adds a whole layer of complexity beyond who I am just as a surgeon or as a doctor.
Just sort of occurred to me just saying that, and it's almost necessary to serve beyond. Almost, it seems necessary to serve beyond your profession. Otherwise, it's almost impossible to detach your identity from your job, isn't it?
Yeah, absolutely. Yeah.
And you move from this. Yeah, this is the highest value I can give. When actually, maybe the highest value might be a kind comment or conversation, or we don't know. As we've discussed with
Yes.
Faith, we don't know. We don't know where the impacts are from anything that we do, and that's not our job to know. It's just our job, I guess, to show up.
Absolutely.
I've loved this conversation. I think it's incredible what you've done in terms of what you went through, what you had to navigate, and really importantly, I guess who you've become. Another thing I've believed for a long, long time is it's the goals aren't the important, but it's who we become in the pursuit of those goals. And you've lived this in terms of your recovery. What would be the most important lesson for anyone listening? I think one of the greatest things we can do is learn from others. And what would be one of the most important lessons that you've learned from this experience that you would like to leave the people listening with?
Well, thank you so much. Yes, absolutely. I think there's been so much built and wrapped around my story. I think the most critical thing for me is the importance of health advocacy. So we will all experience trauma in our life as of one kind or another. Doesn't have to be as extreme as mine, but importantly for me, it's about giving voice to the voiceless. That really has helped me through this whole process. And there's so many unfortunate events that's happened in my life, and now this process, if it can be used to help and serve other people, and even if I just send one message to one listener out there, and that has made a change or possibly a ripple of effects, then for me that is service. That is the what's um I consider the most important thing out of the whole process.
I remember, again, going back to as a junior doctor, and something I would always ask myself before I walked to the hospital is, how can I serve greatly today? And it just helped to reframe to that. Your journey has really, you've had a monumental shift in your perspective and on what service and on how you can show up. And I'm blown away by you are pushing on many fronts now in terms of sharing your message and making sure that what you've gone through, the experiences that you've had and what you've learned is not limited to just you. You're making sure, like through something like this, that your message gets shared, and someone listening, this may be useful right now. It may be useful, might be one of those things that is useful in a few years when some of these things are more relevant to the person. So Shan Shan, thank you so much. This has been an amazing conversation. As I said, I'm in awe of how you've taken this and navigated what's been a really, really tough situation to grow and to have this wider impact and this change and share this changed perspective. So thank you.
Thank you, Sam. Truly, I think I have to congratulate you and for all the wonderful work that you and your team are doing, because we really need a platform like this to really raise voices for other people, as I say, unheard, and actually, hopefully, through this, that lives can be transformed in a different way. It doesn't have to happen on the operating table. So, I very much value your time and space here.
Thank you. It's a privilege.